Greetings, my dear friend, my name is Maxim and welcome to my channel, and today we are going to be discussing Refsum Disease, which is a rare genetic disorder that affects the body's ability to break down a specific type of fat called phytanic acid. This buildup of phytanic acid can lead to a range of symptoms including vision and hearing impairments, difficulty with balance and coordination, as well as skin problems. Despite the challenges posed by this condition, individuals with Refsum disease often show incredible resilience and determination in managing their symptoms and advocating for their health. Though ongoing research and support from healthcare professionals, those affected by Refsum disease continue to inspire others with their strength and courage in facing the complex condition head-on. In order to remember the most important aspects of this disease, we are going to the final among animals in fights without rules. Please note that an ox has entered the center of the ring. The ox is a part-time referee, the referee for Refsum disease. And of course, where are we without our beloved recessive mouse? Today the mouse is also taking part in the battle. We will cheer for our grey friend. As you already know, the recessive mouse in our illustrations symbolizes the autosomal recessive type of inheritance, since the mouse is clearly not a dominant character. Refsum disease is a peroxisome problem. To remember this, just look at our ox referee, ox, for peroxisomes. And now get ready for a dose of humor and simplicity. Meet Elephant. Elephant? Alpha, the star of Refsum disease, with his clumsy wrestling suit adorned with a wacky ox logo. Elephant steals the show. And why is wrestling suit with an ox emblem relevant, you ask? Well, it's an amusing way to remember the alpha-oxidation process required to convert phytanic acid into pristanic acid in Refsum disease. So whenever you think of this condition, just picture elephant for alpha and ox for oxidation for alpha-oxidation. Who knew that elephant and an ox could make learning about metabolic processes so entertaining? Well, keep laughing and learning, my friend. Let me introduce you to the mysterious duo causing a stir in the world of Refsum disease: phytanic acid and Phyton the snake. Picture the slippery snake with a tongue-twisting name, Phyton, slithering around up to no good. Its hissing sound is not too far from the tricky phytanic acid lurking in the body, causing mayhem. It's like Phyton and phytanic acid teamed up for the ultimate prank. And in Refsum disease, it's no laughing matter when phytanic acid decides to overstay its welcome and pile up in the body, leading to all sorts of unexpected twists and turns. So the next time you hear about phytanic acid and Refsum disease, just think of Phyton, the troublemaking snake, and his sneaky partner in crime. Phytanic acid is a branched-chain fatty acid found in the human diet from dairy, meat and some fish. It undergoes alpha-oxidation in peroxisomes to form pristanic acid, which can then undergo beta-oxidation to be used for energy production. However, in Refsum disease, this is an impairment in the enzyme phytanoyl-CoA hydroxylase, which catalyzes the first step in alpha-oxidation of phytanic acid. This results in the accumulation of phytanic acid, which is toxic to the nervous system. In our illustration, to remember that pristanic acid in Refsum disease, imagine a priest who is praying for our fighters. The priest represents pristanic acid. And now let's talk about the clinical presentation of patients with Refsum disease. People with this pathology experience scaling of the skin. As you can see, our phyton sheds its skin, which symbolizes the scaly skin. In addition, patients may have cataracts and night blindness. A fighter trying to challenge the elephant and the mouse is none other than a chicken boxer. The chicken has white eyes, as in cataracts, and chickens are also unable to see at night, which is called chicken blindness. In this way, boxer chicken will help us remember cataracts and night blindness in Refsum disease. An interesting fact about patients with Refsum disease is that they may have a shortening of the fourth toe. Among the spectators of today's event, the main sponsor is a red cat. Cats have 4 toes on their paws, which will help us not forget that the patient may have a shortening of the fourth toe in this disease. Last of all, let's draw ataxia. As you already know, in our illustrations, ataxia is a symbol of ataxia. If you were thinking how we got to this place, to take a look at this event, well, the answer is very simple. By the taxi, of course. Thus, the taxi for ataxia. Well folks, this is all what I have for you today. Thank you for watching. I wish you a very lovely day and see you guys later. Goodbye.